There we go. Okay. Give you a little background on Franchise Benefit Solutions. I am the managing director of Franchise Benefit Solutions. I've been in the business over about 40 years, and our company Franchise Benefits has over 35 years of experience in employee benefits. We specialize in customized benefit programs to the franchise community. That is our niche. That's our name of the company. That's all we work with. We provide exclusive plan designs to franchisees across the United States. Over the years, we've had the privilege of partnering with Authority Brands, Valpak, Comfort Care, Grocery Outlet, The Joint Chiropractic, and Jenny Craig, amongst others. In recent years, the insurance industry has witnessed many changes. Our clients are aware of changes going on, and many have expressed an interest in offering alternative benefit plans to help, like we talked about, recruit and retain employees. We have an understanding of the franchise industry. We focus on building a benefit strategy to develop a long-term relationship. One thing that we find with working with franchisees is there's a franchisee network. They all know each other. They all, if one is happy with what we do, it spreads. If there's a question, obviously that spreads too. We offer you, the franchisor, training and support for prospective franchisees. We find that a lot of franchisees that come into owning a franchise, they come from a management background, but not an ownership background, and they're really not known for running a business. This is where we help you with the back office to work with your franchisees. We offer you an online quoting portal, which allows your franchisees to obtain instant quotes from multiple insurance carriers, and we'll provide you with a web page link to your corporate site outlining our products and services that are available for your franchisees. So why do clients choose us? We know what it means to be a franchisee. We're experts in the healthcare industry. We have knowledge of the healthcare reform. We offer outstanding service, and most of all, the franchisees trust us, like I was explaining. Our advantages: we offer affordable group plans and rates, all with guaranteed acceptance and no waiting periods. Plans and rates are the same no matter where your franchisees are located. If you have a franchisee in Florida, Michigan, Washington, or California, the plans and rates are the same, except for Ohio. No, I'm just kidding. No participation or contribution requirements. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. This is probably one of our biggest advantages here, is because we have no participation requirements at all. So if we have an employer with a voluntary plan says, I've got 2 employees that are interested in joining, we can enroll them. If they have 25 employees and only 2 want to join, we'll take the 2. Franchisees choose the benefits they want to offer their employees, and the employees enroll online through our online portal. Our program portfolio includes medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Plans can be employer paid, standalone, voluntary, or packaged together through convenient payroll deduction. So really, if the employer wants to contribute, they could. If they don't want to, that's fine with us also. They decide how they want to set it up. They choose any of the benefits. It's a platform here. They decide what they want to do. It's total choice of the employer.
Okay.
We offer 3 health plan options. And this is where I think you ran into an issue before, which I think that this would be a solution for you. So we offer 3 types of health plan options. The first is individual and family health plan. And I'll get into these in a minute. Comprehensive group health plan and then a voluntary group health. For those employers that don't want to offer a group plan for their employees, but are looking for an individual health plan for themselves or their family, we offer an online quoting portal they can view at their own convenience. Once they input their personal information, they can compare affordable health plans from different carriers, find out if they qualify for a subsidy, through the marketplace, view benefits at a glance, view local providers, and apply online or download enrollment forms. So basically, you see over here, there's the subsidy that they would receive through the marketplace. These are plans from the lowest to the highest rate. So it outlines what's available to them. Here, we're just showing in Michigan, but for instance, in your area, it would list the carriers that are available in your area from the lowest to the highest, but then it would also deduct the subsidy cost, and then they would have the rate.
Okay.
For those franchisees that are considering their group options, we can help them make the right decision that meets their needs, their healthcare needs of their business and their employees. Group plans are based on the demographics of their company. Along with their employee and dependent ages, we would need census information in order to provide them with a group plan. So there's two types of group plans. One is an ACA compliant, the other one's a non-ACA compliant. So we offer the ACA, non-ACA compliant plans. ACA compliant plans are community rated, while non-ACA plans are based on the demographic and medical history of the employees. So the non-ACA are plans that were available before Marketplace or before the Obamacare came into being. Those are the non-ACA. So ACA plans require a minimum of 2 employees, 2 enrolled employees, and will accept eligible waivers such as Medicare, Medicaid, Marketplace, spousal coverage, or other group plans. Non-ACA plans require a minimum of 5 enrolled employees and will not accept any waivers. For example, if one of your franchisees has 15 employees, a minimum of 7 employees are required. So the ACA compliant, we only need 2 employees. So if you have a franchisee that has 10 employees, 8 of them are covered elsewhere, such as their spouse, their parent, they have another group plan, whatever, they would be waived. So then the 2 employees would fit perfect and we would be able to enroll them. So there's ways of getting around, and I feel with the numbers you have here, we wouldn't have an issue. But the non-ACA compliant plans, those are the ones pre-Obamacare. Those are the ones where we have to have 5 minimum, no matter what.
Okay.
Also under those, the group can be declined based on health history or rated. But we have seen in the past where most groups are not declined, but they could be rated. If somebody has cancer or whatever, they could be highly rated, which may not be beneficial, but we would offer them both avenues of quoting.
Okay.
So far, I've covered 2 of our 3 healthcare options, individual and family, and the comprehensive group health plan. Our third and most popular option is our low-cost voluntary group health plans, similar to an association plan. Our voluntary MEC and limited medical plans are all about access, easy, low hurdle access to the healthcare system, otherwise unattainable for many employees. So this is where 80 to 90% of our business is through this voluntary.
Okay.
And again, the employer selects, they do totally whatever they want to do. So the basic MEC, which you can see here, covers physicals only. And the physicals include the exam, immunizations, any type of testing, cholesterol testing, diabetes, blood pressure, any type. Colonoscopies and mammography screenings are covered, flu shots. So the full exam is covered 100%. The MEC Plus and Premium and Super MEC plans cover preventative services, primary care and specialist visits, along with urgent care, lab and x-ray services, and generic prescription drugs. So as you can see here, the MEC Plus, simple copays, no balance bill, just like a comprehensive plan, primary care visit, 15 copay, specialist is the same. Urgent care, 50 copay, lab test, 50 copay, x-rays, 50 copay, and generic drugs, 15 copay. So again, simple copays, just like your plan you're probably on now.
Mhm.
What this plan does not cover is inpatient, outpatient, and emergency. The average cost these days of a comprehensive plan is probably going to be, for a single person, $400 to $800 a month. As you can see here, our cost here is $109 for a single. Okay, so it's a big difference.
Yeah.
The premium and the super mech include value added benefits, which is a cash benefit payout to help the franchisee or the employee avoid financial crisis. So the member co-pays only, there is no balance bill for those covered services, which is through the MEC plans. They do have to use a PHC network, which is a national network. The value added benefits is through Aflac, but it's paid to the employee, but they can offset their out-of-pocket expense by benefits that are paid to them. So basically you can see $145, but it includes a $500 benefit paid to them for a hospital admission, $300 per day for the confinement. It also includes accident treatment, ambulance, diagnostic testing, and critical illness. I'm going to get into a minute our hospital confinement plan, which we find most employers that offer the MEC plan will also include the hospital confinement. We offer a limited medical plan. Now, this one's different than the MEC because this one has balance bill. So if an employee visits their primary care physician, the cost is $120. This plan will pay $60. There could be a balance bill of the $60. However, if they use a PPO network, then it might cut it down to $80, where the employee then just has a $20 balance bill. I would say that 90% of the sales that we have is more in the MEC plan because it's more of what plans out there are now rather than this type of plan. But we do find some employers, if they're going to contribute, will offer both plans, because this one offers a little more coverage because it also includes lab tests, outpatient surgery where the other plan didn't, anesthesia services, emergency room, urgent care, hospital room and board, hospital admission, prescription drugs. Now the cost on this one is $93 a month. It does offer more, but the one part of this that a lot of employers stay away from is because it has balance bill.
Sure.
Okay, so those are the different plans that we offer. Again, we find, I would say, majority of employers that we enroll will go with the voluntary plans. They may put in, and I'll go in towards the end, they may put in a management only plan where they would go for a comprehensive like Blue Cross or United Healthcare. They will go with that when it comes to management and ownership. But the, like the upfront or the base that you were talking about, this is where they were offered the voluntary medical. So they can use how they want to set it up. So they set up their own solution.
Okay.
So additional voluntary plans that we offer 4 dental plans. The advantage of our dental plan is we have no waiting periods. Most dental plans will have a 12-month waiting period for basic or major services like root canal or caps or whatever falls under major. There's generally a 12-month waiting period. We don't have any waiting period. We cover from day one. Vision, we offer 4 plans, 2 from VSP, 2 from IMED. Those are the 2 top carriers in the country. Our plans have a $10 eye exam copay and a $25 lens frames copay. The difference in here would be the lens frames copay. It's either every 12 months or every 24 months. 2 life plans. We have a group plan, which is employer pay, which is $10,000 per employee, or a voluntary plan, which is employee pay, not employer pay. This is strictly employee pay. They can purchase up to $500,000. Actually, I think it's $150 now. Spouse, I think $250, and children is $10,000. This is all guaranteed issue. No medical questions. We take everybody. Now, this is at time of enrollment. After the enrollment period, then there are health questions.
Okay.
Telemedicine. Let's say one of your employees is at work, got something in their eye or whatever. They can't leave because they don't have enough workers, so they have to stay. They can call a teledoc. They can upload to their app, give them the symptoms to the doctor. The doctor will give them a diagnosis. They'll even call it a prescription. So I know this works. My son hurt himself, uploaded a picture, and the doctor gave a diagnosis and called in a prescription. It's unlimited use for all family members, up to 5, and it's $11 a month. So
Wow.
we find
Okay.
some employers will actually pay for it because they want to be able to offer the virtual visit to the doctor in case they can't go see a doctor.
Yeah.
Additional benefits, accident and critical illness. We find employers will add the accident because it also gives them another option to add, let's say, the MEC plan. It covers more than 50 benefits for both inpatient and outpatient treatment on or off the job. In addition to the benefits, it pays a lump sum for payments for fractures and dislocation. My son fractured his ankle playing baseball, and it also paid for the outpatient treatment. He was able to, or we actually collected on it, the lump sum payment because of the fracture. Okay, it's guaranteed issue. Plan and rates haven't changed since 2014. Offer a critical illness plan. It pays a lump sum at the time of diagnosis for 7 covered illnesses, and benefit amounts are $20,000 for the employee and $10,000 for the spouse. Dependent children covered at 25% with no charge. Final 3 options, hospital indemnity. This is the plan that I mentioned that most employers will include with the MEC plans. Covers both injuries and sickness. Admission per day for hospital confinement is included. Covers outpatient medical treatment received in the emergency room or the doctor's office. Surgery, anesthesia, diagnostic testing, prescription drugs are all included. And this, we offer 2 plans. So it's a medium plan or a high plan. We find that employers will contribute towards the MEC plans and then offer the hospital indemnity as a employee pay. Short-term disability, we offer 3 benefit options, 500, 1,000, and 1,500. It'll pay up to 60%, up to the benefit amount that they select. Plan will pay up to 6 months. And there is a 14-day waiting period for both sickness and accident before the benefits actually kick in.
Okay.
And finally, we offer a discount prescription plan that is free to the franchisee, to the operator. It's a savings of up to 80% on prescription drugs on a 90-day supply. It does not include liquid medication. It is through the Canadian med store. That's why liquids can't go across the international border.
Oh, interesting. Okay.
I know it works. We have a client, excuse me, in California. They were paying $1,400. They were able to cut it down to $400. So I know that
Wow.
that works. Our services include consolidated billing. We'll send them one bill for the different benefits. Online HR services, Section 125 premium only plan, which allows the employer to deduct the premiums, payroll deducted from the employee, and then COBRA administration for groups that have over 20 employees. So how does our benefits enrollment platform work? This is from the time of discovery when we first initially speak to one of your franchisees until the end of enrollment. Our benefits enrollment platform includes 4 steps from the initial contact to the enrollment. Step 1 is the discovery. The first step is to identify the employer's objectives of offering benefits that reflect both the employer and the employee's needs and budget. We will gather the group information, discuss employers' goals, benefit options, and their budget. Step 2 is the analysis. This is where it's important for the employers to be strategic when deciding what to offer. We will review their benefit options, cost, and help them set up a benefits program that will help employer attract and retain employees. So this is where we gather the information, provide them with quotes, come back to them and review everything and work with them on setting up a program. Step 3 is communication. Communication strategy is a critical component to the benefits planning and management. We will develop an easy to understand benefits communication for employers to share with their employees. So we will provide them with an employee enrollment guide. This is where they can distribute to their employees, let the employees look at what's available. And once they do that, then that falls into step 4, which is the enrollment process. This is where we build out an online enrollment platform for them. The FBS online enrollment helps employers spend less time collecting and reviewing forms and communicating benefit details. For employees, they can select the benefit options best suited for their specific needs. We will set up the platform, send the employer a email outlining the benefits available, let them go through the platform, confirm everything. Once they do that, we send emails to the employees, inviting them to the platform to complete their profile and then go through the online enrollment process. And once they're done, they with their e-signature, then the enrollment goes synchronized and goes to the carrier. So it's one application. We send them one bill, one online enrollment and administration system. So from here, the employer can see who enrolls, who doesn't. There's 20 different reports, including payroll deduction report, where they can download, send to their payroll vendor and go from there. So this is a complete system from beginning to end that we offer.
Okay.
So you probably know there's the Obamacare, the open enrollment in October. There's also what's called a group special enrollment. And this is a 30-day window where a group can enroll in a group health plan without no participation or contribution requirements. So under the Affordable Care Act, carriers are required to offer an annual group special enrollment period to employers who would normally not participate or normally don't meet participation or contribution requirements. So if you had a group of 15 and only 2 people wanted to enroll right now, and there's no, let's say, waivers, we wouldn't be able to enroll them because they would need at least 50% of eligible employee participation. Under this 30-day window, we'll take 2 employees. It could be the owner and one of their full-time employees. An employee spouse would be considered as one employee. Excuse me.
Okay.
So we find probably most of our business, 80% of our business is written during the 30-day window. So it's November 15th through December 15th for January 1st effective date.
Okay.
So what is the most popular solutions that we find that help the employer hire and retain employees? I know we've been bringing the same scenario here, hiring, retain employees. So the 4 packages that we find the most prevalent, the first package is the employer offers the MEC plans and contribute towards the employee-only cost. So it's $109. We find an employer may pay $25 or $50 or half the MEC plus cost. The employee contributes balance of the employee cost plus dependent cost and any buy-up. So the employer may offer 2-3 plans. They'll contribute toward the lowest plan, let the employee contribute the balance of what they don't pay plus dependent and any buy-up. Then the employer offers the voluntary benefits, 100% employee pay. And as you can see, the hospital confinement is in bold because they want to package the medical with the hospital. confinement, but the hospital confinement is employee pay.
Mhm.
Package 2 is the employer enrolls in a management-only group health plan through the special enrollment period, which is the 30-day window I just mentioned. The employer contributes 100% for themselves, management 50%, and the employees, they offer the voluntary benefits, which would include the MEC, limited medical, hospital, all the voluntary benefits at employee pay 100%. So they're only going to contribute towards ownership and management. Again, as you can see,
Okay.
the first 2 packages, they decide what they want to do. Package 3 is where they don't include the MEC or the limited. They'll enroll in a comprehensive plan such as United Healthcare or the Blues. The employer offers dual option. They'll contribute 50% of the employee cost of the lowest plan. The employee contributes the balance plus any dependent cost and buy-up, and then they offer the voluntary plans. Package 4, the employer contributes to nothing. The employee contributes 100% to all the voluntary. So as you can see, there's 4 different packages that we find is the most prevalent. The employer decides how they want to set it up. Totally up to them.
Okay. Okay.
Okay. Now we talked about, or I mentioned the training for prospective franchisees. Many franchisees come from the corporate world and aren't trained on how to run a business. We will help you with educating your franchisees with why they should offer the benefits to their employees and help them set up a strategic benefits plan. In today's hiring market, a benefits package is essential for attracting and retaining top talent. Once franchisees have great employees on board, they want to keep them from jumping ship like you mentioned. So here's how we help them on setting up a plan. We tell them don't do too much too soon, discuss benefit offerings with other franchisees, set up a budget. We find a lot of times, believe it or not, we'll find a new franchisee come in and they'll say, hey, I just talked to this franchise down the street. I want to do the same thing. But that franchise has been around for 5 years and are able to afford, contributions or whatever. This franchise being new, we kind of take a step back and say, well, you want to think about it. Make sure you have a budget. You stick to your budget, what you can afford, because a lot of times when it's a new franchisee, our suggestion is either not pay for benefits, offer it at 100% employee pay, and then once you're more settled, then start thinking about offering or offered management, set up different classes. So
Right.
We work with them.
Okay.
We suggest provide plenty of options. And then we suggest they partner with a broker. We hope they, go with us, but we suggest that if they know somebody local and they want to work with them, make sure they trust that a broker.
Okay.
Okay, and then you also mentioned before about loyalty. Why offer benefits? So we will explain to them why offer benefits to their employees.
Mhm.
So how long does it take to set up a program? It generally takes about 2 to 4 weeks. We're working on one right now that another franchisor that we met during the IFA show. I think we started working with them about 2 weeks ago, and we're actually sending out a email to their franchisees probably this afternoon. So we're talking
Okay.
months. So this project scope takes, we'll develop a program brochure, set up the branded page, provide online quoting engine, develop additional marketing resources, and we offer an introductory webinar where we would have a webinar for all your franchisees. And then if there's specific franchisees that want to have a webinar with their employees, we'll also provide that. So whatever we need to help your franchisees, we're here to help.
Okay.
Branded page. This is kind of what the branded page would look like. The medical plans, all our plans would be shown on the branded page. They have the availability to reach out to us. There's different ways for them to reach out, but we offer the branded page that we could link to your corporate site. So that's basically our program and how we would provide our programs and services for your franchisees.
Awesome. Yep, that seems to check the box, doesn't it? That's a pretty inclusive setup as far as what some owners would want and what other owners would want to provide and things like that to their different stores. So I think that's interesting. I like it.
Now, I will tell you that generally what we find for the franchisees, once we go through the program here, take time to study it, make sure this is what you're looking for. They will discuss it with their advisory team. We could work with, if you have an advisory team, we can work with one of your franchisees just so they could see how our program works, and then they can report back to you. However you want to set it up, we could work that route too.
Okay.
Totally up to you.
Yep. Okay. No, I think that's that's good. One question I have, so and you have to forgive me because I'm not real sure on how some of this works, but as far as, so we want, let's say we go with one of those options where the employer pays maybe 50% and then the employee pays the other 50%. And you said there's a report that's generated that we would then send over to the payroll company to kind of match those numbers. Is that how that would work?
Yes.
Okay.
So
Is there any?
Go ahead.
Is there any direct integrations with any current payroll providers that you all do that with?
We could, or our enrollment platform will allow them to integrate. There is an additional cost to it, but they can integrate for ADP. I think there's different platforms for ADP. I think there's a couple different platforms that they could work with. I think Paycor is another one.
Yeah, we're looking at Paycor.
Oh yeah, I think Paycor is another one, and there's a few other ones, but yes, they could integrate, but there is an additional cost to them.
Okay, is that just a one-time cost to do the integration, or is there an ongoing cost to keep the connection?
I honestly don't know much about it. My son handles the implementation side, so he would have more news on how that works.
Yeah. I'm just trying to make sure that however the franchisees end up structuring it, that the movement of information from one system to another is as seamless as possible. That's kind of I'm trying to make sure that what we're packaging together for them, everything from advertising a job to onboarding an employee to keeping them engaged to providing them benefits to paying them on a weekly basis, is all connected and all as streamlined as possible. And Paycor seems to be a pretty central spot for the majority of that. And having that, and I know that they've got an open development platform and this and that and the other. So if you all have the ability to connect, I'm sure that Paycor connection, if it doesn't exist, can be made. So yeah, just wanted to make sure that's feasible.
Yeah, I'm pretty sure Paycor is one of them.
Okay, yeah, they've got a lot of partnerships, I know. So I think just how they've set up their platform and stuff to make it so open. So
yeah, I know technology these days seems to move forward every day. We're having some of our carriers right now in the process of integrating with our enrollment. So as soon as an employee enrolls, it automatically, like you said, is seamless with the carrier. So it automatically goes to the carrier and they're enrolled for the, depending on the beginning of the month of coverage. So everything seems to be seamless from the time the employer approves the enrollment platform through the employee going online, inputting, completing their profile, all the way through signatures. So it's really seamless. Employer doesn't have to be involved. Obviously, you don't want to be involved in, you're talking to your franchisees want to go through corporate, but obviously liability and, with franchisees having their own tax ID, can't do any of that. So that's what we're in here for you.
Okay. And then really from the franchisees perspective, like they're going to work with you all to identify what package is best for them and what they want to offer and set all those things up. But once they do that, like that process for each franchisee is going to be customized to them, but basically the same process from start to finish with everybody.
Correct, 100%.
Okay. Okay.
Yeah, everyone's
Cool.
gonna have their own needs and, what they're looking for, what the employees are looking for, how they set it up. Well, everyone could be different.
Okay. Okay. No, I think this is great. What I'd like to do is I'll probably share this recording with my advisory council group so that way they can all kind of chime in on it and see what kind of questions we have. And then it will probably go from there. So that way, because I do think that this would meet the immediate needs of some of the stores. I've got 2 or 3 of them that are really wanting to do something like this sooner rather than later. And so maybe we can get 1 or 2 of them on board and then go through the process. And then as they start talking about it, I think they'll share that experience and things like that. Like just like you said, good news and bad news travels fast.
You got it. They have their own
once they get
little-
in there and start using it.
You got it. You got it.
So-
So, yes. So what I'll do then is I will send you the recording. I can also send you the deck here.
Okay, that'd be great.
So then you'll have all that. And then I'm open anytime for questions, and then get back with me if you have any questions, and we'll go from there.
Yeah, that's great, Bernard. I really appreciate your help.
Okay, sounds good. Have a nice weekend, and we'll talk to you soon.
Thanks, you too.
Okay, take care.
Bye-bye.